Hi everyone, my camera decided to have a little bit of a hiccup. So in that time, I've gone to put my face on. It didn't take very long, it was just 5 minutes of makeup. And now you can tell what I look like before and what I look like after. As you can tell, I don't use a lot of makeup anymore. In the past, I used to cake the thick eyeliner on, but now it's just as simple as possible with a little bit of eyeliner and then false lashes and a little bit of eyeshadow. But going back to what's important is, who is Dr. So? So in MVP, there are 3 surgeons and only 3. You have Dr. Choi, who's the head surgeon, then you have Dr. Hyun and Dr. So. I can't really say much about Dr. Choi or Dr. Hyun other than that they are extremely friendly and they love to laugh, but they didn't perform any surgery on me. So with regards to my relationship with Dr. So, he was extremely polite, extremely soft-spoken, and very patient with all my questions. I am actually someone who's quite meticulous and I tend to ask a lot of questions when I don't understand something. But he was always extremely patient with me and always encouraging me to ask more questions, which was what I extremely appreciated. Now, a couple of you asked, what are Dr. So's specialities? When I was told about him, he was introduced to me as someone who was specializing in rhinoplasty. But when I obviously was focused on getting revision done first and foremost, then he was introduced to me as someone who specialized in revisional double eyelid surgery. So I can only testify to what is in front of you, and that's my eyes and my nose, and I have to say he's done a marvelous job. And I've known 5 other people who've been operated by Dr. So, my sister included. She had primary double eyelid surgery done, and she looks beautiful, but then in my eyes she's always beautiful. And then I've also met 5 other Kakao girls and seen their before and after photos. They had double eyelid surgery done by Dr. So and they're extremely happy. I think one had rhinoplasty as well. So some of these Kakao girls I'm no longer in contact with, but the ones that are still on Kakao, unfortunately they're a little addicted to plastic surgery now, and that's not what I want you guys and girls to get into. Know what you want, go get it done and be happy with yourselves, because like I said before, if you're not loving of yourself, or if you don't learn to love yourself, then no amount of plastic surgery is going to satisfy you. Okay, moving on to the next question. What are consults like? So consults range like crazy. If you are at, when I was at any other clinic, most of my consults lasted an average of 5 minutes or 10 minutes, whereas my consults with Dr. So lasted an average of 20 minutes. Yeah, I'd say around an average of 20 minutes. So in your consults, some surgeons will rush you. They will just be like, roll their eyes, and you can tell they don't really want you there, and they've got more pressing things on their table that they like to attend to. And then you have someone like Dr. So, who is extremely attentive, asks you if you've got all your questions answered and if you can think of any more questions. He'll also be very hands-on. So unlike some surgeons, they just look at you and they give their feedback, but Dr. So was very hands-on. So he would touch my face, he would move my skin, and I would also tell Dr. So, this is what I'm after. I'd like to cut my epis and cut them by 2 millimeters. And he would say, and then he would play around with my eyes, and then he would ask me to hold the mirror, and he would say, all right, well, we'll definitely do epicantoplasty for you, but we're only going to cut maybe about 1 millimeter rather than aiming for 2. Because if I cut 1 mil, we'll have the epifold removed. But if you cut 2 mils, it might look a bit too close. So then he pulls my skin together and he showed me in the mirror, this is what I'd look like where my eyes would look too close together. And he explained to me his fears, and I said thank you so much, because I obviously don't know what I'm asking for. What I thought would look good, obviously in practice might not. So that's something I can only truly thank Dr. So for. So don't be afraid to speak your mind, and Dr. So is someone who will also tell you what he truly believes. All right, how to do well in consults. So in consults, the best thing for you to do is to write a list of questions. Regardless of all the answers you have heard or read online or even from this video, sometimes it's best to ask and get reconfirmation from the surgeon himself. So you can ask things like, this is what I plan to do. Is there something else I'm missing? What kind of methodology are you going to use? How long is recovery? What should I do before surgery? What should I do after surgery? Ask all these things and gauge how interested the surgeon is in you. Actually, all right, yeah, that's fine. I'm sure he won't mind. Or you can also ask, relevant questions at relevant times. So ask him about healing procedures post-op. That'd be more polite of you and of me, I suppose. Okay, bring photos of what you think looks good. So if you think a set of eyes look really nice, or a nose looks really good, bring those photos in. And be realistic as well about what is achievable. For example, there was this Korean model's nose who I thought was absolutely adorable, and I wanted her nose. But in terms of what the potter, the potter can only work with the clay that he's given. And Dr. So explained to me that my nose length wasn't long enough to achieve a nose that looked like in the magazine. So it's important to be realistic with what you want. Be careful of surgeons who promise you everything that you want, and also, be careful of what you ask for as well. A lot of people with a bent nose might go in and say, look, I want rhinoplasty. Can you please give me what's needed, or the basics that are needed? But if you have a curved bridge to begin with, the surgeon might actually have to shave your nose before attaching the silicone. Oftentimes I hear people from other clinics complain about their post-op surgery because they ask for bridgeplasty, tipplasty, and ala reduction, which are the three basic ones with rhinoplasty, and they come out and they have a bent nose or a curve shaped nose, and they say, well, how come it's not like in the pictures, or why is it not meant to be the way I thought it would be? And that's just because the surgeon was told these are the three procedures they wanted, and the surgeon just gave it to them. But the surgeon can only work with what's already there. So be careful of what you ask for, and be realistic about what you ask for as well. I think that in that situation, Dr. So might say you won't be able to achieve that straight bridge unless you shave part of your bone. So going on, know what you want. Yes. Another thing that comes to mind is I went to a beauty clinic to inquire about my eyebrows. Ellen had said, if you don't get any surgery, that's fine. You've got, a decent looking face, but make sure you get something done with those eyebrows. I might have said that in the previous video. So anyway, I went to the beauty clinic, and the beauty clinic said that my skinny eyebrows had no hope. They can't operate on it, and even if they did, it wouldn't look very good. So then they decided to say, why don't we give you a new hairline instead? And I'm thinking to myself, really? Do I need a new hairline? And that made me a little bit insecure, because sometimes when people say something bad to you, that seed can be deeply implanted. But you have to remember, what's real and what's a clinic just saying to make more money off you. So just to prove that I don't actually need a new hairline and that I'm not receding, just know what you want and make sure you're not being sold something that you don't actually need. And that's happened to me in several other clinics as well. You know, I think that some clinics, they realize that we are foreigners and we're not in Korea often, so they push as many procedures as they can and try and make you a little bit insecure so that you'll buy into those procedures. I even asked my now best friend, who I met in Korea and on Kakao, if I really needed a new hairline, and she said, don't be silly. Okay, moving on. You want to ask about methodology. Methodology is really important because when I wanted to reduce my alas, I wanted to have the sides of my nose here cut and to bring the folds down. When I brought this up to Dr. So said, if we cut the sides of your nostrils, there's a greater chance for scarring. And he thought that risk wasn't worth it. And he said, if we cut the base of your, the base in between the nostrils and the columella, then I would achieve a better result. And he was right. And I actually met a girl later on who had scarring on the side of her nostrils. So I can only thank Dr. So for the methodology that he recommended. And also lastly, write notes. I couldn't stress this more. I did 6 consults, 1 on my first day and 5 on the next day. And by the end of the next day, I was pooped, but I had to go back and review my notes. So if you don't take notes, you are going to forget what happens in every consultation, whether or not it lasts 5 to 10 minutes, because it's just go, 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 and you have only limited time in Korea. So do take notes, be as precise as you can be with your notes. Just write everything down that you hear, and if you don't remember it, you always have your notes to fall back on. So remember to take notes, especially with the surgeon and then with the consultant. Now, doing your consults is 2-part. So you go in, you ask for a consult with the doctor of your choice, you wait for the doctor, you go in and see him or her, and you ask your questions. Hopefully he's going to touch your face and be a little bit hands-on, and then you're going to take some notes, you're going to ask your questions, you're going to take more notes, and then you're going to be escorted out with the consultant, and you're going to sit down with him or her, and she'll start talking to you about the procedures you might like to do, and she's going to give you prices. And in my next video after this, I'm going to talk about what you can do to try and bring the price down. So I'll see you in the next video. Thanks.